As you know, there are some exciting advances in medicine every day. So let's look at the role of biotechnology and how it impacts ACL injury.
Year after year, the chances for a successful recovery from an ACL injury continue to improve. This is in good part thanks to advances in biotechnology and the science of sports medicine that help optimize the healing process. Unlike many ligament and tendon injuries in our bodies, ACL tears don't heal simply by sewing the torn parts back together. This is why we use grafts to replace them. After an ACL reconstruction, a complex healing and remodeling process begins that we call ligament ization, where the graft tissue undergoes changes to actually become a new ACL. For a detailed overview of ligament ization, check out this video. What makes biologic treatments so promising is their potential to optimize and speed up this complex healing process. One day, they may even make it possible to simply repair or regenerate a torn ACL. In this video, we're going to discuss 3 of the main types of biologic interventions: 1. PRP, 2. Stem cells, and 3. Biologic scaffolds, and give you an idea of how they work. So what is PRP? PRP is an injectable product that is prepared using selected portions of your own blood. After a small amount of blood is drawn, it is placed in a centrifuge and spun at high speeds to separate out its components. The part we're after here is the plasma that has the highest concentration of platelets, or platelet-rich plasma. Once the PRP is collected, it is injected directly into the site of the action. Once it's there, the platelets work to stimulate growth factors and other cells that are essential in healing. Now let's move on to how stem cells work in ACL treatment. Stem cells are unique in that they have the remarkable potential to mature into different cell types depending on where they are used and how they're activated. They are essentially the blank canvas of the human body. Stem cells are harvested from areas where they are plentiful in the body, such as bone marrow from the iliac bone of the pelvis. The harvesting process can be painful, so it's usually done under anesthesia. Once aspirated, the bone marrow with stem cells is processed and then injected into the target area, similar to how it's done in PRP. The stem cells find the area of damage and the body lets them know what type of cells to become. They have the ability to turn into cells that help repair and create all types of tissue, such as ligaments, muscles, nerves, vessels, bones, you name it. Now let's move on to another exciting technology: biologic scaffolds. These scaffolds are engineered to replace the natural architecture of the ACL, providing a biologic frame to help guide your body as it heals. You may be thinking of scaffolding at a construction site, and in reality, the concept isn't far off. The scaffold is there to lend support to the work in progress and to allow the delivery of tools and equipment, or in this case, healing and repair cells, to the site. In theory, these scaffolds may strengthen or even speed up your repair. Pretty amazing, right? Taking what's already in your body and using it to help you heal. While scientists and doctors are working hard to perfect these technologies, it's important to remember that they're still relatively new. Plus, blood draw procedures and biologic augments have risks of their own that must be considered, and are often quite expensive. So while the early results are promising, there is much work to be done until these are ready for everyday use. In any event, doctors have had many years of great success in treating ACL injuries using today's techniques, so be confident. No matter what techniques are used, your treatment team will do its best for you.
We hope you've discovered some good information. Keep coming back to ReadySetMed for all your medical needs.